Welcome. Periodontics has always been thought of as involving mere scaling, root planing, as well as some routine flaps. Periodontics, though, has a lot more to offer than that. One of the most clinically relevant procedures that we employ in day-to-day dentistry is something called crown lengthening. And that's what we're going to discuss over the next half an hour. I'm going to give you an overview of what crown lengthening essentially involves. Crown lengthening can be divided into two major aspects. One is functional crown lengthening, the second one being aesthetic crown lengthening. The reason one differs from the other is because in functional crown lengthening, we utilize the crown lengthening procedure primarily so that we can place a full crown or something on a diseased tooth, essentially a tooth which is broken down, versus an aesthetic crown lengthening is primarily done, as the name suggests, for aesthetic purposes alone, where it may or may not involve some other restorative procedures such as placing of veneers and so on. So the most common procedural aspect of this is for something as simple as a gummy smile. So in the next half an hour, I'm going to talk about the differentiation between these two procedures. I'm going to involve a very important concept, which is biological width, which you may already be aware of, but we are going to see how the nitty-gritties of biological width play a huge role in either of these procedures. And I'll touch a little on flap designs, because flap designs and incision designs are fairly important, whether it involves aesthetic crown lengthening or functional crown lengthening. And we'll talk about some steps in the surgical procedure before we conclude. In a situation like this, where you have a broken tooth, as you can see, it's fairly impossible to place a crown, because you need to take into consideration the ferrule effect, which is basically you need to have the crown margin on sound tooth structure. It cannot be placed on a build-up. So in this situation, if you had to build this tooth up, there is no way that you could place the crown margin palatally on sound tooth structure. So the crown placement is only possible with this procedure called crown lengthening, wherein we essentially lower the gingival margin and the bone margin so that we can place the crown on the appropriate height and the appropriate position. One of the most common mistakes which is done in dentistry is placement of crowns without regard or without respect to the biological width. Now, the biological width concept I'll just touch on in a few slides later. But as you can see in this photo, for instance, there are deeply placed crowns and you have a lot of edema, a lot of inflammation along the gingival margins. Now, the most common thing that dentists do is that they blame their patients. They say that the oral hygiene is inadequate or that the patient hasn't followed instructions. However, the truth of the matter is that this is more of an iatrogenic process, wherein the crown margins themselves have been placed too close to the bone margin. So if you start placing crown margins really subgingivally, you will impinge on the attachment of the connective tissue fibers to the tooth, thereby leading to an inflammatory and an edematous process around the gingival margins. If you see both central incisors in this photograph, you can observe that the gingival margins around both the incisors seem really boggy, the margins are inflamed, and both these crowns have been placed a few months ago. Now, in spite of repeated debridement, repeated scaling, the patient keeps reporting back with this. So obviously it's not really a problem with oral hygiene, but the problem is something called impingement of biological width. Now, biological width in simple terms is nothing more than the distance between the gingival margin and the bone height. In crown lengthening, what we essentially do is that we increase this length, this distance between the margin of the existing gingiva with the existing bone margin so as to accommodate a new crown. As I had mentioned earlier, there are two aspects to this. One is the functional or a prosthetic crown lengthening, and the other one is the aesthetic crown lengthening. In simple terms, this is a diagrammatic representation which shows what it involves to do crown lengthening, a functional crown lengthening. As you can see, there is decay beneath the gum line, and the second step in this procedure is to reflect a simple flap and assess how deep that cavity or that decay is. Take down the bone margin and then place the gum margin obviously at a lower level, and if you can compare step 1 with step 4, you can see that the gingival